Are you considering bleaching or whitening your teeth? Well, today we're going to go over different considerations and procedures and options to do that. So what is the difference between bleaching and whitening your teeth? So frequently these terms are used interchangeably, but for the purpose of today, if I say whitening your teeth, really what that entails is removing any sort of extrinsic stain that's on them. So that would be like coffee, or you've had a lot of red wine or anything like that, some smoking stains. Whitening will remove a lot of that. Bleaching, however, can take your teeth up another level. So it will go above your natural level of whiteness to go a little bit higher. So that's from bleaching. So generally, when patients ask about whitening or bleaching their teeth, something to consider is whether or not you're just wanting to remove some of the stain that's on your teeth, which sometimes just a cleaning can help with that, kind of polishing some of that off, or if you're really wanting to kind of go up another level and get kind of those really bright pearly whites, then something a little bit stronger, some sort of bleaching agent might be better for you. So what factors can affect the rate of change or how quickly your teeth lighten or respond to bleaches? One of the biggest factors is the kind of shade that you already have. So there's kind of two main categories that we'll use. There's kind of the more yellowish and brown color of staining. It's a little bit more standard, but then sometimes we'll see more of a grayish shade to teeth. And those gray kind of stains and colors in the teeth are usually harder to bleach and do not respond as well. They will get lighter after a while, but really the yellow kind of brown shade does respond a lot better to bleach generally. What different types of whitening and bleaching options are there? So there's kind of four main categories that I would say. One is having it done in office, in a dental office. Another one is to have custom trays manufactured. A third would be a take-home kit, and the fourth would be whitening toothpaste. So definitely consult with your dentist to see what might be the best option for you. Are there any considerations for your current fillings and crowns? Yes, definitely. So crowns and fillings will not bleach further. So if you're gonna have fillings or crowns done, generally what I recommend is to bleach your teeth first to their desired shade, and then afterwards we can match the the crowns and fillings to the shade that you've picked, because if we do it the other way around, it's harder to control getting the bleach up to the shade of the restorations. What are some conditions or situations where bleaching might not be a great option? So if you have tetracycline staining, which is something that can happen during the formation of teeth. That always doesn't always respond super well to bleaching. Sometimes it can't get quite up to the shade that you'd like. Another situation is when there's demineralization of teeth. So sometimes you'll see if you have different kind of white spots on your teeth where some areas are a little bit lighter than others. Bleaching sometimes can make the discrepancy a little bit more obvious. So it will lighten everything, but it'll probably make the bright white spot really white. So it kind of depends on what you're going for. And then also fluorosis, which is when you've had too much fluoride. Sometimes that doesn't respond super well to bleaching products. How long will the bleaching last? It just depends on your teeth and how light you're wanting to keep them, and kind of different factors that affect you. So, if you're drinking a lot of things that stain your teeth, a lot of coffee, a lot of tea, that sort of a thing, it's probably going to take a little bit more work. Especially if you're wanting to keep them super bright white. But I would say general, kind of as an average, most people, once they've gotten it to the shade they like, usually only need a touch up maybe every year or so. But that's not a hard and fast number. Like I said, it really depends on how white you're wanting to keep them and your lifestyle habits, that sort of thing. Is bleaching safe? So yes, generally bleaching is safe. One of the biggest concerns that we have is with sensitivity. So for some people, what can help with that is maybe spacing the bleaching a little bit. Maybe instead of doing it every day, if you're using a take-home kit, trying every other day. Another option could be using some desensitizing toothpaste. That can help regardless of which type of bleaching agent that you're using. Another consideration is, especially if you're doing take-home bleaching kits, is to make sure you don't get any bleach on your gums, because that can definitely leave a little burn mark. It will, fix itself. It's not going to be there forever, but that definitely can be painful, and we don't want to damage your gums if we can avoid it. Okay, well, thanks for watching. I hope that if you're interested in bleaching or whitening your teeth, that you've learned something today. If you have any other questions about bleaching or just otherwise dentally, please leave them in the comments below. Thanks.